welcome to Ask Melissa Almost Anything, where we talk about your life and your body, where we believe your health is your responsibility, that you have a choice in your health care, but most importantly, that pain is not normal. I'm your host, Melissa Meiste with Nephew Physical Therapy. Today, head, shoulder, knees, and toes. We're talking about foot, ankle, and toe issues. Now, small muscles, small joints, an area of the body that is often forgot about unless it doesn't work. And let's be honest, if you like walking and independence, let's be honest, it's really one of those most important things. This weekend, we had a wonderful, busy family weekend celebrating one of our family miracles, someone being cured of cancer. Praise Jesus. And found myself on my feet for hours. And while my Keens that have heel straps, by the way, if you're going to be choosing the knee sandals for the summer, we'll get to that in a minute, wore some decent shoes, but was on my feet, standing on cement, serving hot dogs, talking to friends and family, enjoying the festivities. But man, my feet were killing me by the end of the day. Do I think there was anything I could have done differently? Probably should have worn my tennis shoes, but they didn't match my outfit. But otherwise, when let's just say our feet let us know when they're not happy. So let's talk about shoes first. And if you're joining us today, please, again, put your questions in the chat. We're happy to answer them live. If you have questions later at any time, you can message us, personal message us here at Nephew Physical Therapy, because we, again, are here to serve those of you in our community and in our greater community, because I have friends around the country, even in other parts of the world. We want to give you the tools to take care of yourself. You know, one of my favorite Melissa-isms is, it's my job to work myself out of a job. What does that mean? That means when you are a client of ours, we want to diagnose you, which is, let's figure out what's wrong and what's going on with you. We want to treat it. We want to do manual therapy, which I'm telling you, if you have foot or ankle issues, you want somebody to touch those feet unless you have a foot issue. I can't believe people wouldn't want their foot to be touched. One of my favorite things. And then we're doing exercises. We're doing all those things, and eventually we're moving to discharge with an average treatment duration in our office is about 10 visits. So we're talking 4 to 6 weeks to get you back to living life without pain. Now, do I like the fact that we focus so much on pain? No, I don't. But as a culture, giving pain a voice is what we do. And when we talk about it and we tell others, what we often forget is it really is impacting our life. When I'm in pain, if I have a headache, I'm not going out to dinner with family. If my knee hurts, I'm not doing the fun things I enjoy like volleyball or softball. So when things are hurting, they're getting in the way of our quality of life. That's why we talk about it so much. That's why we say, because pain is not normal. It is not the way God intended us to live. So it's our job to come alongside you and work ourselves out of a job, get you feeling better, give you the tools to take care of yourself moving forward, right? Short commitment, lots of work, so that you can feel great going forward. So let's talk about shoes. Let's be honest. I like a nice fun flip-flop. Easiest thing to put on when I'm going to the garden to pull some weeds, easiest thing to put on and off. In the summertime, flip-flops seem to be the easiest and best choice. However, most flip-flops have this much support, this much cushion, okay, first of all. So we're not getting a lot there. You're almost better to go barefoot. However, the biggest thing about a flip-flop, it's a Monday, flip-flop is the fact that with every step, okay, and you take that foot off the ground and you're in the swing phase of gait where that foot's coming off the ground and coming through the air, you are squeezing those toes to keep that flip-flop from falling off. Did you catch that? So that shoe just doesn't stay on naturally. When we tie our tennis shoes, we're not having to contract the bottom of our feet, our toes, every single step. Flip-flops, if those toes aren't contracting and keeping that flip-flop on, that little wedge between your first and second toe is not going to keep that shoe on. And if you have ever had plantar fasciitis, I'll say that very close, slowly, see, I'll even stumble all over it. Plantar, meaning the bottom of the foot, fasciitis, meaning inflammation of the fascia, and an excessive overuse injury of the muscles on the bottom of the foot. The flip-flop is nearly certain to aggravate it, possibly bring it on, and definitely make it worse because you're overutilizing those very small muscles of the foot. So if we think about the anatomy of the foot, and anytime we talk about a joint, the shoulder, the back, the low back, the neck, every part of our body is designed by the Creator to do a specific role. The foot is designed, when we look at the lower extremity, from the hip all the way down, it is designed for a lot of motion. So if you are walking on uneven surfaces, which is a walk on the beach, a walk in the woods, something rocky, any of those changes in surface, not a nice smooth cement floor, carpet in your living room, any of those things, when we're walking on those uneven surfaces, because there is so many bones, which then means there's many, many joints, which means there's many, many ligaments to connect those joints, which means then that there's lots of little teeny tiny muscles to move those bones and joints, creates lots of mobility so that we don't fall over every time we take a step in the woods. What that also means then is because of the size of those muscles, because of how small they are very, very vulnerable to overuse injuries. That's plantar fasciitis. When we're using something more than it was designed to do. So I'm going to use an analogy I've used many, many times. I like to think of the hips and the butt, right? That glute muscles, big, beefy, strong, large muscles. That's 6'5", 300-pound guy. That's your linebacker, your sumo wrestler, I don't know, whatever. Think of some of the biggest, strongest people you know. Because the hip doesn't move in 180 degrees and do all this motion that the foot can. It's made more for stability, and it should be the main power that moves us forward, sideways, and rotation with our motion. The foot, which is further on down the chain, so we go large, hip and glutes, medium, thigh, quads and hamstrings, small, calf, get down to the foot, we're in the extra small muscle region, okay? So if the 6'5", 300+ strong guy isn't doing his job, that little 5 foot tall, 100-pound gymnast down at the foot can't do the same amount of work because their job is different. So when we're identifying repetitive use injuries, when we're talking about plantar fasciitis, right, one of the most common things that is being treated in physical therapy today for foot issues, for a variety of different reasons, we need to look at the chain. Now, yes, we're going to get in there and poke and prod. We're going to check, is your calf actually flexible? Because loss of calf flexibility prevents your toes from moving upwards. Makes everything tight. So yes, you have to have flexibility and strength in the calf. And many of the muscles that do big motions in the foot come from the calf. But then we get into those smaller muscles, and if they're getting overutilized, we're checking for joint tenderness. Okay, are those joints moving well? We are looking for muscle soreness. Is it more where it attaches to where the Achilles attaches to the heel? On the back side of the foot? Is it where that plantar fascia attaches to the heel on the underside? Is it those teeny tiny little muscles in between the bones and the top of the foot that are often forgotten? Do the joints move well? Check, does the big toe move, flex and extend the same as the other foot? We're comparing side to side. We want things to be equal, and that's the great thing is most of the time when somebody comes to us with a pain of any kind, it's usually one-sided. And so because we usually have two, that gives us that opportunity to compare to what's normal for your body. Some people are more flexible. Some people are more tight. That doesn't make it right or wrong, it just makes it you, and we take that into context. So when you're evaluating for an issue like plantar fasciitis, you can't hardly, in my opinion, ignore the function of the gluteus maximus and the tightness of the hip flexor. All right, so I'm going to try to show you here real quick just that comparison. So hip flexor right here in the front of my hip, glute here. When I am walking, if I don't open up here, that doesn't allow me to bend backwards and open up because I'm always like this. If this is tight, I won't be able to use my glutes. Okay? And so this muscle will start to atrophy and go away. There will be no booty left. This muscle will continue to get tight. The whole body will then shift this way. So we'll start to see an anterior tilt. Okay? So now I've shifted to using my back. My butt goes away. Hip flexor stays tight. Oh, and somewhere down here, I am going to have big, giant calves because now I'm not using the glutes to move me forward. I'm using my calves. And then, subsequently, we may overuse the foot or overuse the knee and hyperextend there. So really, when we talk about the core, everyone's like, how do I get stronger in my core? And often that is mistaken, again, just for talking about the abs. But if we have a healthy foundation, which I think is a much better word to describe the core, we are going to, yes, have strong abs, okay? Sorry, this does not connect to how much insulation you have on your body. Because I think you can have a strong abs and have a little extra insulation, especially here in the north. But you need those abs to work. But really, you need those glutes working, you need those hamstrings working, and then you need flexibility in your hip flexors. Because the hip flexors are the thing that gets so tight because, again, we sit too much. Who knew that your sitting would bother your feet? Okay? So again, plantar fasciitis, one of the most common repetitive injuries. We address that treatment-wise by doing manual therapy because you got to kind of work it out. So that can be some of the most painful and yet amazing massage. Depends on how much you like it. I like when we get nice and deep into my foot. And believe me, after standing for hours this weekend, I could really use a good foot rub. So we're working on the plantar fasciitis, right? That plantar fascia down there. We're massaging the calves if we've lost flexibility. So that hands-on treatment is super important. Following that up at home, right? So if you're not formally a client in our office, which I think you should do that because it's probably the best way to get feeling better. And I'm biased. Yes, I know that. What you could do at home is you can do the simple trick where you take a tennis ball and you rub the ball of your foot over that you can do some self-massage that way. If you're more of a masochist, you can use a golf ball, but I kind of don't recommend it because it's pretty hard. So a tennis ball where you're doing some self-massage, rolling that through, getting a little bit deeper into those muscles, okay, will allow you to do some self-massage. You can also then do some self-massage on your calf. That's a little harder rubbing-wise. So that's where if you have one of those, like a Rolleiflex, a muscle roller of some kind, a baking rolling pin, you can use that. It doesn't have as much flexibility or give as these exercise models, but that's kind of what you're looking for to do some rolling on that calf. You can also do that rolling with a foam roller. I am very cautious in recommending people doing heavy-duty foam rolling without unweighting some of the muscles and joints because I think it's just too aggressive. And if you're going to be loosening a muscle, it can't be contracting and fighting you every step of the way. Okay? That's why I can't massage my arm as well because it's hard to relax when I'm doing the work at the same time. So those are the things we do initially, is you got to decrease all that tissue tension because then you're going to retrain it. And the retraining then comes in looking at that whole lower extremity chain. That is making sure, and that's where we can assess that with good manual muscle testing. I can tell you which muscle group you're weak in. Is it just the one side that's painful? Is it a combination of both sides? I will tell you, 99% of the time, weakness is not just one-sided, at least from an orthopedic perspective. What we see is those muscles going back and forth being weak. And so we look at those kind of things. All right, so we keep that in mind. But that involves then specific stretching, which sometimes is the calf, but I'm telling you is often the hip flexor. Okay, And then we're getting those glutes engaged. We are getting all that stuff functioning better so that that foot then, as time goes on, we then can get to more dynamic activities like balance, maybe jumping, depending on what you want to do. Of course, this depends on your priorities. Walking, stairs, hiking, sports, gardening, you name it, we want you to get back to it. Okay, so that's kind of what therapy looks like at Nephew Physical Therapy from a clinical perspective. And I share that information because I do have friends all over the country that ask, how do I find a good therapist? I'll go off on a little bit of a rabbit hole here. One, do they do manual therapy? I think that's super, super important. Number two, what is your ratio therapist to client? Now, here, we're one-on-one. The whole time, you're going to get our full attention for that hour. Other clinics might be using text to coordinate on your exercise. I'm a big proponent of of a physical therapist or a physical therapy assistant guiding you through those exercises because you want an expert. You want somebody that understands movement. And I can tell you, it doesn't matter if you see a physical therapist here or a physical therapy assistant, they are going to give you high quality feedback. Because if you're not, doesn't matter how many you can do, it's the quality of doing the exercise. All right. So you're keeping in mind then ratio therapist to patient. You're thinking about manual therapy. Do they guide you through your exercises, or do they just tell you to go jump on that bike and do that and leave you alone? And then do you like them? Let's be honest. I think one of the biggest challenges in healthcare is people keep providers, whether it's their primary care physician or their therapist, that they don't like. I mean, you don't have to love us, although I think you will if you spend time with us. But I think there has to be trust and some sort of relationship. The reason we love, in my family, our primary care physician is, yes, he's advocated for us, but when we go to him, he listens, we have a relationship. He's been with us since the birth of our first child. He knows our family. That relationships matter. So I think, really, my advice to all of you is find a physical therapist, a physical therapy clinic that you have a relationship with, and make sure you have that primary care provider, because those two things, when it comes to managing the medical side of things, the testing, the coordinating with specialists, whatever you may need, that combined with somebody who can help you take care of your physical self, those two people, I think, can make the greatest impact in your everyday life. And when something goes wrong, because inevitably it will, you have a resource of somebody to reach out to. So let's go back to footwear choices. Okay, one of the things we want to talk about today, and my apologies, what does it mean when your nose itches all the time? It's either that it's going to rain or you're going to get a bunch of money. I don't know. I can't remember what these symbols stand for. All I know is my mouth gets dry when I talk. All right, so footwear. One of my favorite things is if I'm hanging out in the gym and I listen to Christine, which, by the way, best physical therapist in Holland, Michigan, voted by the Holland Sentinel readers. Woo woo! Like, we're so excited about that. One of the reasons why I know she is the best is she will hammer that foot issue almost immediately. It's almost like a broken record. People come in, and again, this is pretty much anything from the waist down. Back pain, hip pain, knee pain, leg pain, numbness and tingling, foot issues for sure. When was the last time you bought a good pair of shoes? Not how good do your shoes look, because they can look pristine, but if you have been wearing those shoes for longer, and again, I will say this depends on your activity level. If you've been wearing them more than 6 months, they are probably toast. And in some situations, our shoes are toast in 3 months. Runners, most runners know they need to be replacing their shoes regularly. If I go all the way back to my physical therapy training, one of the pieces of advice I was giving is if you're a runner every day, it is actually recommended that you buy 2 pairs of the same shoes and you alternate them every other day. Why is that? Because you're going to give the fibers, right, the stuff that supports it, polypropylene, whatever the shoe is made out of, at least then 48 hours to rebound, because you're taking that day off. And so whatever that is in that material, right, because it gets compressed every time we run, right, we're compressing that down. It needs some time to bounce back to provide that cushion again. So sometimes then buying 2 pairs of shoes and alternating them every other day, you're not buying new shoes until maybe 6 months or so. However, you're buying 2 pairs. And of course, as you know, the best pair of shoes no longer are the $100 shoes. I remember, oh, 50 felt like a lot, then 75, then 100. I'm telling you, the best pair of shoes costs $150. Now, is that how much I want to pay for shoes? No. Do I regret it every single time I buy the cheap pair? Yes. Or I buy the kind that maybe I liked that looked a little bit better? I'm telling you, don't do it. Go to a great place that sizes you, asks what you do, looks at your feet. Here in Holland, Gazelle is a great shoe store because they really do a thorough investigation. We recommend many of our clients to go there. By the way, we have some coupons that we could gift to you. And we recommend because they really look at your gait. They ask about what your use is with that foot. They try a variety of different sizes because some shoes are wide and narrow, more for running, more for when your feet roll in, your feet roll out, all of that kind of stuff. So highly recommend investing in a good pair of shoes. What gets most of us in trouble isn't necessarily our sneakers. We know we should have good sneakers. We know that it's probably our best choice. It's the stuff in between sneakers and flip-flops. It's high heels. It's sandals. I've got some slip-on Sperry's, right? Obviously, it's your boots. It's your work boots. It's your cowboy boots, right? Like all of those kind of things because there's more to life than sneakers and flip-flops. And so it is really an individual choice. And I can tell you, having treated clients who all they want to, I should say women, right? Who all they want to wear is a heel, that's part of their personality. So is there much chance I'm going to convince them to go to a flat or go to a tennis shoe? Probably not. However, I can educate you, right? I can give you information in regards to how that works and what stresses and strains it does and, all those kind of changes. I just, in general, believe in function over fashion. I prefer comfort over fashion because I want to feel good at the end of the day. And what I have learned is, again, my tennis shoes may look great. They may look pretty and new, but when my lower legs, my calves and my shins start to hurt, I know my shoes are done. I get to the end of a day of treating clients or I've been on my feet at home, and when everything hurts, that shoe is done. And it's time to make another investment, not expense, investment in good footwear because I'd rather have good footwear so I can go walking, spend time with my family, be in the yard, even in the house, which, by the way, let me add this. I digress or get distracted, whatever term you want to use. I know here in Michigan, a lot of people take shoes off in their house, right? Because it's kind of gross. I mean, do you really want to track in what's, you picked up on the floor in whatever store? And I'm not even talking about COVID at this point, right? Because that's where all the gross stuff is. So one of the things I do see a lot of people doing more and more is actually having a pair of house shoes. Now, I'm not talking slippers. And let's be honest, I have a pair of Crocs that are really not even a better choice. Having a pair of inside shoes, especially if you have hard surface floors, right? Hardwoods, concrete underneath linoleum, concrete in general, investing in some inside shoes really could just handle some lower, right, that risk of getting some everyday aches and pains. And here's what else I know. When I don't wear good shoes in the house and say I'm stuck at the sink washing a load of dishes, it's not just my feet that hurt. It actually shows up in my back. Well, that's also because my glutes aren't strong enough and my abs aren't strong enough, my hamstrings aren't strong enough. But those two things are related, okay? Without a doubt, I definitely see a correlation between strength in the core, which we already established is butt, gut, and hamstrings, and the function of our feet. So make good footwear choices. Make sure that you are investing money regularly on shoes. If you are working in a plant, right, in a factory, concrete floor is the norm. Obviously, if you have to wear steel-toed shoes or boots, make a good choice there as well. Yes, you need to protect yourself because nobody wants to drop a steel beam on those toes, but make sure that there's got some good support that fits for your foot, because feet have high arches and flat arches and roll in and roll out, which I will tell you, I think they roll in and out because of, oh yes, the hips and the glutes. But make sure you're finding a shoe that supports you the way that you need to and that you're making that investment regularly. Another area when we talk about feet and ankles is the ever common ankle sprain. So the question I often ask is, what is the most important thing to do when you sprain an ankle? And I will tell you, not because I like to point out that people are wrong, but I think the mark is often missed. So we use this terminology called RICE, okay? Rest, ice, compression, elevation. What do you think is the most important thing? Should I rest it? Should I ice it? Should I compress it? Or should I elevate it? The answer is, shockingly, compression. Compression, yes. So think about this. You sprain your ankle. You're in the middle of a game. Let's say you're wearing high tops. If you take off your shoe, you now have allowed the skin to stretch as far as it wants to. Nothing is going to stop it, okay? Now, if you're going to take that shoe off and get it wrapped up with an ace bandage or a sleeve or something, that's what we're talking about when we say compression, because we don't want to allow that skin to continue to stretch. As the skin stretches, that signifies that we have more inflammation, swelling. So when we have more inflammation and swelling, we lose joint motion. We now have more pain because we have all this extra stuff going on in that joint. It gets way more crowded. I like to describe inflammation, joint inflammation, like this. So I'm in one of our treatment rooms, which is 10 by 10. And in here by myself, one person, I got all kinds of room in a 10 by 10 space, okay? But what if inflammation, added 15 more people to this room? That's the definition of pain to me. Stuffiness, crowded, hot, miserable, right? That's inflammation, is when you have more people in the space than you wanted to begin with. So how do you, and yes, compression, right, is narrowing the space. So cut the room in half, okay? So compression, what it does is doesn't allow more people to come into the room. It's keeping the door closed, okay? So keep it compressed. Do a figure 8 ace bandage. Just make sure your toes don't lose circulation and go purple. That's what you want to be doing. And sometimes you can get those sleeves where they can slide up and over. So compression, the most important thing for an immediate ankle sprain. With that, though, comes rest, ice, and elevation. Rest, don't walk on it, okay? And walking on it, really, how do you determine how soon you do that? When you can walk without a limp. So that's where crutches become part of the slow graduation process. And initially, when it's painful and you can't even put weight on it, the crutches allow you to take 100% of the weight off your foot. But as time goes on, you put some weight and a little bit more weight and a little bit more weight, but every step of the way, the key is that you're doing that without limping. Eventually, you sometimes get down to one crutch, which of course should be used on the opposite side of the ankle or affected leg. The same is true for those of you that use canes, by the way. If you've had knee replacement, knee issues, hip replacement, that cane goes on the opposite hand to provide that balance, because we don't walk like robots. Let me just show you this analogy. It's one of my favorites, right? I don't walk like this. I think that's the Michael Jackson video for Thriller. No, we walk in opposite patterns, right? My right arm goes forward when my left arm goes forward, and vice versa. So we want to make sure that that rest component is connected to not limping, because limping will make everything else hurt. Icing. Good icing is probably 10 to 15, maybe 20 minutes at a time. You want to give that joint a chance to relax. You don't want it to think it moved to Antarctica, okay? So put that ice on it, surround it. If you're really crazy and aggressive, put it in a bucket full of ice and water. That you probably don't need to do for 20 minutes because your feet might fall off. but good icing. And again, whenever we ice, it's cold, burning, aching, and then we get to numbness. Okay? So that icing is, again, 15 to 20 minutes every 2 to 3 hours. So take time off in between. Let that circulation return. Let's get that stuff out. But icing is one of the best things for pain management and to get the swelling down. The last thing in our rest, ice compression, elevation. Here is the trick to elevation. It must be above your heart. Elevation is not laying in the recliner with a couple pillows underneath your foot, because your foot is probably, unless you've got, the biggest pillows I've ever seen, a couple pillows is not enough to get that foot above your heart. And, oh, by the way, when you're in the recliner, your heart is actually above your hips. So no, you need to lay on the floor or lay on your bed and lift that leg nice and high. So gravity, the key here is gravity, allows all that fluid to move back. What happens in foot surgeries, ankle sprains, anything to do with the foot that's kind of a traumatic injury of some kind, not these repetitive injuries or repetitive issues like plantar fasciitis. When you have an actual injury, because the foot is at the bottom of your body, and every day, whether you're sitting or standing, that fluid is going to fall down. And when we have a post-surgical foot or ankle, when we have an ankle sprain, we're not utilizing the muscles and joints normally, right? Because we've injured it. And so the muscles and joints are not helping to push that fluid back up so your body can process that fluid all back through. And it pools or accumulates around the foot and ankle. If you've had foot surgery, that can happen for months, if not maybe a year after your initial surgery, because you're trying to get normal function, normal strength, normal flexibility to return to that region. So what you need to do is artificially pump that fluid back through your body so it doesn't accumulate down there by elevating your foot above your heart. Bonus would be to do ankle pumps or write the alphabet with your ankle, do some circles, get those muscles contracting to move that fluid out. Challenge is if you are in the acute stages of that ankle sprain or shortly after surgery, no, you're not going to want to do a lot of movement because it will hurt. That's normal. But as time allows, the more you can move that foot, the more you can contract the muscles in the calf and in the foot itself, the more you'll be able to move that fluid back through your body. And when we get that fluid out of that joint, normal motion returns, that pain goes away. I get rid of the extra 15 people in the room and can shut the door behind them, and things start to move back to being normal. Okay? So initially, and this is true again with those foot surgeries, because we've had a number of people in the clinic lately who've had foot surgeries, they still, even after therapy, have to manage that swelling on a regular basis unless they decided to walk on their hands. And that's not happening. So because we walk on our feet every day, that is where you may need to manage that depending on how the day goes. The more active you are, traditionally it feels better when we're farther along in that rehab. But if we're stuck at a desk, right, sitting, hopefully you can stand up. That will, of course, help. But when we're sitting too much, traveling in a car, all of those kind of things, that fluid will accumulate. So you want to manage that the best you can, again, using RICE. Rest, ice, compression, and elevation. Lastly, let's talk about, oh, there's a comment. I'm not even seeing it. How am I missing it, Rachel? Got Rachel here to help me. Okay. Sorry about that, Elaine. Oh, I wanted to see that. This is so great. Elaine says, I just went to Gazelle last week and got great service and a great pair of shoes. My feet feel 1,000% better. Yes, that is awesome. I'm so glad that you said that. I have been buying my last few pairs of shoes from them. Their customer service is phenomenal. And they really don't expect to be in and out of there in 5 minutes unless you've bought shoes before. And you're like, I know exactly what I need. I'm replacing. Because they actually are trained salespeople. Not just, hey, come sell shoes. No, they do research all the time. They have the vendors coming in, all that kind of stuff. So yes, I appreciate that a lot, Elaine. Thank you for pointing that out. I recommend that to everybody. Again, if you're not in our community, find the local shoe store that really invests in the education, taking the time with their team to make sure that they know what they're doing and how they're taking care of it. Awesome, awesome, awesome. All right, let's end on this note, okay? I have definitely suffered from plantar fasciitis. For me, it's always in the right foot, comes and goes. Here's what I also know about my body. Oh, wait, I have sprained that ankle numerous times in high school. So much so that I think the last time I sprained it, I was running to the outfield playing softball, stepped on a ball, totally twisted it sideways, didn't even swell up. Because here's the thing, once you sprain a ligament, it never comes back. Unless you have surgery. And I don't think I've ever met anybody who's actually had a ligament repaired on their ankle. Maybe professional athletes, but I don't know a lot of that. So when we sprain something, those ligaments, which are a passive structure that connects bone to bone at a joint, okay, we've got that happening there. Once they stretch out, they're not like a rubber band where you stretch it and it comes back. It's like it's been stretched out over time. It stays. And so when we have those sprains, as we were talking about earlier with rice, I almost forgot this fact, so I'm glad it just popped into my head. What we have to do is we have to compensate for that loss of stability. So yes, our ankles and feet are made for mobility so that we can walk through the woods and climb the sand dune and do all those things. But if you sprain or strain your ligament, it will not come back. So what we do then is we focus on rebuilding muscle strength. Locally in regards to the foot and the ankle, and of course globally from the hip down. So I have a history of ankle sprains in my right plantar fasciitis, overuse. Guess what? I know it all comes from the fact that I don't keep my glutes strong enough. When they're strong, I don't hurt. When my foot starts to hurt, I gotta work those glutes again and do proper squats, lunges, bridges, all these great activities. The key to all of this, right? The point that I'm making in all of this is I believe strongly that most of our aches and pains, whether we're talking about head, shoulder, knees, and toes, neck, shoulder, knees, and toes, most of our issues, one, stem from sitting too much, gravity's winning, and to fight that, we need to be stronger. Getting strong is hard. Staying strong is harder. I hear Naomi say that all the time in the gym. And believe me, one of my favorite things is when people leave exhausted because she's pushed them. But if you want to feel better, whether you're in your 20s, 30s, 40s, 50s, 60s, 70s, 80s, 90s, I'm telling you, strength is your friend. So if you're needing help, that's what we do, right? We are here to help figure it out, get to the root of the issue, whether that's the foot or the glutes, get to the root of the issue to figure out how do we get you better, how do we teach you what to do, and how do you stay better, which is how do you maintain strength? Because eventually physical therapy turns just into exercise. So invest in yourself. While physical therapy certainly has a cost, we've talked about this a few different times on different videos, your body, you get one. It is an investment. Don't make your ankles or your foot feel like an expense. Invest in them. Buy good shoes. Buy good shoes regularly. Keep moving and stay strong. Until next time, remember, pain is not normal. Do something about it.